amazing in both improving what they do and innovating what they do. We've tried to get vaccine out both at our mass sites, but also where people are. And their ability to move quickly and go to where people want vaccine is really incredible. So I think the mayor's priority right now is let's get together and find all the ways we can to get vaccine into arms and make sure that everybody's vaccinated. I think he continues to have concerns about the level of vaccination and equity across the city and really wants to improve that. And I think he would put to the council, he put to every community organization, let's find a way to work together, host sites, and do the things we need to do to make sure our population continues to increase vaccination.
Thank you so much. At this time, I have a number of questions, but I want to open it up to members. Alderwoman Shantia Lewis.
Thank you. Aaron, I got a quick question for you. So actually it's a two-part. So one, can you tell me the communication from the mayor's office to the council and what that looks like? Because I don't recall seeing an email come through. I did see the news release, but I didn't see the email come through. And that's one of the things that I say to you all the time, communication and making sure that we are keeping that line open and transparent. So that's one, on how we made that transition and what that communication looks like. But then two, the other part of this would be, is there talks about incentivizing the vaccine? I just was listening to MSNBC this morning, and they, if I'm not mistaken, it was New Jersey, or I can't, let me not say which part, but they have that raffle and going on, and their shots increased by like 50%. So, and I know there are a number of other cities across the country are doing incentivization for the vaccine. So those are the two-part question.
Sure. Thanks, Alderwoman. Madam Chair, committee members, the first thing I want to say is I think the way this decision and the news of it was communicated was not what it should have been, particularly the council. And I think the mayor recognizes that, certainly let us know at a staff level that he was disappointed that that didn't happen. Our office apologizes for that. He does not like to read things in the newspaper, and neither should or do you, I'm sure. So please accept my apology for not communicating better on that. In terms of incentives, I think we've all seen some really interesting stories. The Ohio lottery seemed to be very successful. I don't know that Wisconsin at the state level is looking at doing things like that, but even things like, this is a successful one in Erie County and Buffalo and was duplicated here with Black Husky Brewing. You get a shot, you get a beer. We're certainly looking at all those things. The commissioners brought them up, and I think anything that helps people get the shot and addresses those equity issues that we have is going to be something that we are going to look at and try to implement. So thank you for that.
I appreciate that, Aaron. And then I'll say that we definitely need to make sure that the Board of Health is in the loop as well, because the chair of the Board of Health reached out to me as well. So that's problematic for me. So we need to make sure that we're doing a better job of communication. But I kind of feel like a broken record. I say that quite often. So I'll reserve the rest of my questions. I just wanted to get that out before we even had a robust discussion. Thank you, Madam Chair.
Thank you, Alderwoman Lewis. I think that's about 50% of the reason why we're having this hearing. In other communities, because we're often compared to other communities, many of the legislative branch held and participated in public hearings like this before a mask order or a public health order was rescinded. So considering that since the very day we were sworn in and I was chair of this committee, this item has been item number one every single time. It was certainly surprising and disappointing that we had no idea this was going to happen and what it was going to look like and how it was going to be implemented. So we don't need to keep going over it, but that's a big part of the reason we called the special hearing. Before I have my questions, I want to make sure I open it up to committee members. Alderman Spiker, did you have anything to ask at this time?
Yes, thank you, Madam Chair. I agree with my colleagues on the communication piece. I won't reiterate that, but just acknowledge my agreement there. With respect to the vaccination rate in the decision, so we had talked earlier on about R being greater than ones could lead to, obviously exponential growth. Is there a vaccination number below which we wouldn't have even considered this? I'm just wondering how we decided that the vaccination numbers were sufficient. Was it that the absolute number was sufficient, or was it that we were plateauing and so things weren't going to change? What was the reasoning there?
Thank you, Alderman Spiker. I can speak to the decision-making around the vaccination rate. Initially when the guidance came out from the CDC, I don't remember what the day of the week, it was a Thursday, but I don't remember what date that was. We had internal conversations. I spoke with Alderwoman Dimitrievich and President Johnson and the mayor's office about potentially using a vaccination rate as a threshold. But we did move away from that because I think we are doing everything we can to get vaccine in arms. I'm tremendously proud of the work that our health department has done. There is resistance in some populations, and I thought the burden should be used as a better measure. And just to be clear, the vaccination rate was never tied to the health order, and initially it was the testing positivity rate that was the threshold that was going to be looked at for the lifting of the health order. And we added burden later because that really was what the CDC guidance was. So it was the burden and the continued exponential decline of our burden.
Yeah, and the reason I'm sure there was testing and no vaccination rate considered initially is there was no vaccine, so that couldn't have...
No, there was no burden considered initially. It was just testing.
Right, and that was a change under you, which I think was to the good. So Milwaukee is a city of neighborhoods, and there's quite a bit of variation in terms of vaccination rate in different populations and in different sections of the city. Do you have any concerns that this kind of one-size-fits-all policy is going to lead to deleterious effects in certain sections of the city as opposed to others? And if so, how have you addressed those concerns?
So I really feel strongly that as I said, our burden's headed into a decline. If you look at what occurred last summer, the numbers continued to decline over the course of the summer, and they didn't really start to increase again until September. I think that gives us this summer to get more vaccine in arms. So I'm not concerned about what may occur over the course of the summer in terms of disease spread. I also just want to note that because we are expiring the health order does not mean that we couldn't put it back in place if our numbers were to turn around in the fall. And I think that may be somewhat misunderstood, but if we are in a scenario that something occurs like it did last year, I would not hesitate to put another health order in place.
Right, and I would just note here that we last year suspended the parking rules and then put them back into effect, and lo and behold, people weren't too keen on following them again. So it may be that putting the genie back into the bottle in fall may be a little harder, especially if you get people used to not having masks and not worrying about them. It may be a little harder than we think to get them to go back. Things would have to be really drastically bad for people to be willing to go back. That's a fear I have. I just wondered if you had considered that, and if there's any steps we could take, or if we're just, going to be trying to change. It's just really hard to go back rather than maintain, I guess is the point.
I can appreciate that. We have had conversations around what that would look like and how difficult it would be. I think every decision that's been made in this pandemic has been incredibly difficult. There is no right solution for any of this. The CDC's guidance around individuals who are vaccinated can be unmasked in public. It makes it very hard for us to enforce a mask ordinance. I think that was one of the driving decisions around some of this. And is it a perfect solution? No, but I think we're just in a position, and knowing that our burden is continuing to decline, and knowing where our cases are, and knowing the original intent of health orders, that it was time to expire them.
Yeah, and I guess I should have led. I'm not necessarily disagreeing with the decision as a whole. It's just I had some questions which I think are reasonable. Other people might have, and I heard, strangely enough, the same rationale being used for a different decision than us, in that some people say, well, there's no way to tell who's vaccinated and not, therefore we have to let everybody go without masks. And some others said there's no way to tell who's vaccinated or not, therefore we can't let anybody go without masks. So just wondering, and it's been a tough time on businesses. I mean, they've borne the brunt of enforcement here, which might not be entirely fair. I understand the circumstances that led to that decision, but so was any thought given to, I know the CDC was basically guiding you here, but other cities making different decisions to stick with the mask mandate, given how impossible it is to separate the vaccinated from the unvaccinated, and given how prevalent the unvaccinated are in the population still?
Absolutely. I want to be clear that this decision wasn't made lightly, and it was made over the course of 5 days of looking at the entire sort of landscape and picture of what's occurred in Milwaukee, what's occurring around us, and the potential implications. Absolutely.
Okay. Thank you. Thank you, Madam Chair.
Thank you. Like I said, I have a number of questions. Many of them I put in the letter to call this hearing. I see other members that have joined us, and I want to make sure I recognize them. Alderman Nick Kovac, Alderman Russell Stamper II, and Alderwoman Jocasta Samaripa, Alderwoman Milele Cogs. Do any more members of the committee have any additional questions at this time? Okay, and then I want to go to my colleagues that are present. Any other Common Council member have questions at this time?
Madam Chair?
Yes, Alderwoman Milele Cogs. Good morning.
Good morning. And my apologies, I may have missed this, but based on the numbers of vaccination in the population, by race, by age, by gender, who is the least vaccinated and thereby possibly the most at risk? Once we begin to lift all of the stuff, that risk still remains. I'm just wondering which parts of the community and who in the community are the greatest at risk.
Sure. So it's a great question, Alderwoman Cogs. Thank you. The population least vaccinated is the 20 to 30-year-olds age group, and then there are pockets throughout really the entire middle of the city that have lower rates of vaccination. So our African American community specifically have lower rates. The lowest census tract, I think, is 21%. I'm sorry, I can't name the census tract off the top of my head. But all of our vaccination efforts have been focused on those communities. I actually have a document. I'm sorry I can't share it because some of the sites are incentivizing their vaccines, and it's not public yet, but we actually rank our requests based on SVI and risk, and that's where we've absolutely focused our vaccination efforts.
And again, if this has been covered, my apologies. I know that recently vaccinations became available for youth 12 and older. One, I wanted to know, what are the rates of kids that have been vaccinated thus far, and how soon on the horizon might a vaccine be available for children under 12?
Also good questions, thank you, Alderwoman. So as of last week, it was 8.8% of children from 12 to 15, 8.8% of children in Milwaukee who are 12 to 15 were vaccinated. So it's an amazing number given it's only been available for a little over a week. And then we anticipate, and the guidance we're hearing from the federal government is that the vaccine will be available for children ages 2 and older in September. That said, the vaccine has been made available probably a month earlier than anticipated in every case. So we're hopeful that it'll be available before school starts.
Thank you. That's all my questions for now.
Thank you. I'm going to begin my questions and then see if there's any more from committee or colleagues. I would like to put a finer point to the question that Alderwoman Milele Cogs had. That's the 20% census track. I specifically requested her aldermanic district, the vaccination rates, and I know that was a challenging kind of map to get. And I'm not able during the meeting to click on the census tract stuff. The 21%, I guess I'm just trying to get a feel, the 21% when you say census tract, what zip code is that?
I think it's 53210 or 53206. Hold on, I'll try to click on it while we're in this hearing.
Okay.
While I do this, you can ask your other questions.
Okay. Well, I guess, so regardless, our city is roughly at 40%. It went to 41%. There's some parts of the city that we're trying to take a closer look at that are at 20%, which means that as the health order is rescinded and there is no mask mandate in place, there are some places that could have people maskless, and 80% of those maskless people are unvaccinated. And I just really want to understand, because I've been told over and over through interesting emails and stuff to follow the science. The science to me that I heard from the CDC was vaccinated people. Let me say that again, vaccinated people. So roughly the 40% of people currently in Milwaukee to be maskless when you're vaccinated. I get that, that's very clear. I just don't understand the science that stated that unvaccinated people should go maskless. And furthermore, when it's a very overwhelming majority, nearly 80% in some parts, how that could be a positive step forward. And I do want to hear a little bit more about why a metric was not considered, or could it be reconsidered? Could we get to 50%? That is the thing that I am really wanting to shine some light on. And I don't think it's fair to say things like, we don't know when we're going to get there. And this last question or statement is, the city of Wauwatosa, the mayor just said recently that they have a goal to get to 80% vaccinated in their city by the end of 2021. What is our goal and our milestone and our timeline for something similar?
So I can speak to the point of no one has ever suggested or asserted that individuals who are unvaccinated should be unmasked in public. I feel strongly, and again, the CDC guidance is very clear, that people who are unvaccinated should be masked when indoors and when in public. That goes for schools, and to be very clear, the guidance, the MPS and the CDC guidance is schools should remain masked. School districts can develop their own policies. Businesses can develop their own policies. We encourage and support any organization or business that wants to maintain a mask policy. So I don't want that to be misunderstood. In no way, shape, or form have I ever said or thought that individuals who are unvaccinated should be unmasked in public.
But, Commissioner, you're rescinding the very order that requires the masks. So I guess I'm trying to, why didn't we consider a simultaneous action for those that are unvaccinated? I guess that's what and this is one of the reasons to have the hearing, is how we are going to implement this going forward.
So the ordinance is tied to the health order, and the data that is driving keeping the health order in place is telling us that we should given that the health order was put in place really to prevent severe outcomes and deaths. And this is to the point of the areas of the city that are less vaccinated. If you look at the ages of the individuals who are vaccinated across the entire city, the older population is most vulnerable and most at risk of being hospitalized or facing death is much more highly vaccinated. And I'm sorry that I can't dig into the data deep enough to give you specifically by census tract what the population vaccination rates are in terms of age. It would take us some time to do that. So the only number I can give is that if you look at a census tract, that overarching number of individuals vaccinated, not those who are most vulnerable within that census tract.
So the United States is roughly at 60%. The state of Wisconsin's higher. Dane County's in 60s. Why have we somewhat plateaued? Like, how long have we been at 40%? In your opinion, why do you think that we are much more lower than other places?
So we're almost at 50% with individuals with first dose. So the 60% in Dane County is first dose. The number that you're citing for this country is first dose. So we're at almost 50% at first dose, and that number increases roughly between 3 to 4% a week. And that's been tracking for the last few weeks. So we are still increasing the number of individuals who are being vaccinated.
And my other question, I know there was a lot of things clumped together, just citing that the mayor of TOSA, what is our plan for the city of Milwaukee, our strategy and timeline of what thresholds and metrics we want to reach in vaccination? Like, do we want to get at 50% by a certain time, 60? I would imagine that if we had that strategic goal, that our decisions would be outcome-based, and I'm trying to understand that timeline and the resources we put into it.
So I can speak from the resources that the health department's put into it. We've put we are doing everything we can to get vaccines in arms, and we're partnering with our community partners to do that work as well. The science says that between 70 and 80% is herd immunity. I've been reluctant to put that number out there because I don't want us to stop when we get to 70% either. I really think that we are going to continue this vaccine campaign until every single person who wants a vaccine can get it in their arm. And we, as the health department, and I can speak to Dr. Tomorrow's team, they've done a tremendous job of doing what they can. I mean, just this morning we had a conversation about, we purchased backpacks so we can have mobile units at Juneteenth, for example, or at the Bucks when they come back next week when they play against the Heat. And we're literally going to have teams with backpacks to start vaccinating people where they are and where they're interested in being, where we can get to them. So again, I don't want to put a threshold out there that may not be attainable, but also that would be superficial. I think from our perspective, we're not there yet, and we just want to keep putting vaccine in arms. That is absolutely our focus.
And I'm glad that you brought that up because a woman wrote to me on that very item. Much of the communication my office received happened to be from parents of children under 12. And when we say we just want to get the shots in people's arms, there's a lot of really young arms that would love to have shots, especially under the age of 12. In fact, according to the census, about 15% of the city of Milwaukee's population is under 12. And I guess, what do we say to parents that are reaching out to us? I was just looking at Miss Ashley Thompson, her comments in the e-comments, and she was just really worried about I have to do the visual honor system of people. We don't really need an honor system because we have data, and the data shows us that we're at more than roughly 60% unvaccinated. But what do we say to those under 12 that cannot yet be vaccinated, and specifically those under 3 that are, per CDC, unable to wear a mask? What modifications should they make as the mask order is lifted with the rescinding of the health order?
So twofold. One is, the guidance is still individuals under the age of 12 should wear a mask when they're in public. We know that's effective. The vaccine is coming for younger children, but the other piece is that we know that the disease burden in our younger population is significantly less than it is in our older population. Which is why the emphasis was on vaccine for individuals over the age of 65, which is why we're seeing much higher rates of vaccine in that older population. And again, why the emphasis has been on the most vulnerable as we move forward. That's not to say that there are children who haven't gotten sick or been critically ill. Certainly that has occurred. I'm not going to pretend that it hasn't, but it's much less of a burden in that population than it has been in older populations. So again, that's why the emphasis has been on the older population. It's not to say I'm not concerned either. I have a 5 and a 6-year-old. The first day my 15-year-old was eligible, I got him a shot in his arm immediately. I took him to the Wisconsin Center. I am also concerned about my 5 and 6-year-old, but when they are out in public, they're masked. To your point about 3 and 2-year-olds, it's absolutely a challenge. But again, we know that the disease burden in that population is much lower. Their symptoms are much less severe. So again, the vaccine's coming for that population, but we're just the situation we're in.
And what data do you have on the long-term effects of the children under 12? Anything new that I'm not aware of?
No, I mean, there are cases where kids have had some long-term effects, but again, those cases are rare. This is not a large percentage of the population. It's not a large percentage of the population because children under the age of 12 are much less affected, but it's also the percentage of children who have long-term effects who've been infected with COVID is very small as well.
I did have a moment to look at the census tract. Looks like 96, kind of east of Washington Park. I know we have a couple aldermen here. 53208 is at 20% vaccination. Have we thought about things like door-to-door or other methods? I mean, that is extremely low. And one could ask in that specific area, if people are on an honor system, without us requiring masks, there could actually be an adverse impact, potentially. I certainly hope not. What would you say about that, Commissioner?
So we have scheduled vaccine clinics in that specific census tract. We have one at the Washington Park Library, 2 or 3 days a week. Again, when we are scheduling our mobile clinics, we are looking very specifically at the areas of our city, the census tracts that have the lowest vaccination rates. That's where we're focused our efforts.
Madam Chair, can I throw something in? Do you mind?
Yes.
Thank you. I think I'd like to underline my point earlier and go back to the mayor. I think there's no wrong way to get a vaccine to somebody if they're ready to get it. And I would certainly encourage all the committee members, your colleagues on the council, work with the commissioner and find ways to host clinics. As I said before, they've gotten tremendously innovative at just being able to be at a place quickly and do a good number of doses when people are ready. And I think, we all know about vaccine hesitancy, and that's certainly an issue, and it's one that we're also working on. But I think there are lots of ways to increase access to where and when people are ready, and I think it's going to take all of us uniting and getting together to get more shots into arms. And I think the census tract is a great example of that. So I'll throw it back to the commissioner. Thank you. I appreciate it.
Well, I want to make it really clear, crystal clear. You have seen very few other advocates like myself. I changed the whole structure of this committee. I totally support the health department. I think they're doing amazing, innovative things. The axe throwing, the Brewers tickets. Our questions are not to be taken as a judgment on the great work of our health department. Our questions are during a pandemic for us as the city leaders and society to make sure that we're together turning over every stone possible. And the numbers and the data reflects that we have to all do better. So this is the time where we want to try things that have never been tried before. And I can think of no better department to implement those, but that has to be a united effort. I don't think anyone in this meeting can feel good about a 20% vaccination rate. And I don't know until we ask people, but I have a hard time believing that in 53208, 80% of the people are hesitant. We've been, I believe, suggesting that a lot. And if that's the case, there's other things I've seen. We could survey people. There's in-home vaccinations now. I just want to make sure we can do what it takes. And when you rescind the health order, it does give symbolically a feeling like things are over, and they're not. But again, I do like the progress we're making. I see the data. This is a great conversation. My last question, and then I want to open it up to, I see Shantia Lewis. This one's important. I see that the Milwaukee County has continued their mask order, I believe, within their buildings. So maybe this is for Aaron. Given that the health order is rescinded, this is super confusing, but city buildings are beginning to reopen, and the mask order that was attached to the health order is therefore rescinded. What will be the decision, like Milwaukee County in city buildings and amenities going forward? I know we're trying to communicate. Hearing that this decision was reached in 5 days, and during none of those 5 days was the council made aware of it, is frustrating. So I'm trying to correct that going forward. What is the decision then on masking in the city of Milwaukee, at least in our own facilities?
So in the continued practice of following the evidence and the science, I'm going to have the commissioner answer this one.
Thank you. So the policy, my understanding, and we've been working closely with the Department of Employee Relations, so the policy related to city buildings is really being driven by the Department of Employee Relations. So that is their decision. We've shared all this information with them. We've also shared the CDC guidance around, as you know, the unvaccinated should be masked indoors. And my understanding is the policy is being worked on that masks would be required in city buildings and public spaces. I have not seen the final version, and again, this is not a decision of the health department. This is really that policy is being driven by the Department of Employee Relations.
Interesting, thank you. With that, let me go to Alderwoman Shantia Lewis had her light on.
Thank you, Madam Chair. So this is a great time for me to ask my main question. We're talking about, and I do know that vaccination hesitation is a real thing. And so we've got a lot of folks who still just don't want it because of, you know, the rumors that are going around, like you can put a magnet to your arm. I had literally at least 15 people say, is it true you can put a magnet to your arm and it's going to stick? And I'm like, no, it's not true. Try it. It's not true. So there are a number of things that we could do to ramp up. I know I've started to see some of the commercials, so that's phenomenal. I think, and the mobile clinic that you all mentioned is a great way. I actually called one in for my church, and they came out in a moment's notice, and we had a makeshift clinic in the foyer of our church so that we can get the vaccine to the people because they were not going out of their way to go get it. So I think we definitely need to do some things like that. But what in this conversation, it sounds to me as if there may need to be another mask order put in place and really specific to those who are unvaccinated, because an 80% unvaccinated rate is very problematic, especially in the minority communities, the Black and brown communities, which are a part of the most vulnerable communities. So if we're saying, you know, the mask order is gone and then you have the honor system in place, I can tell you right now, even during the pandemic, getting folks to wear their masks when everyone was supposed to was still very problematic. So to, you know, not having any identifiers, which I totally understand. It's a HIPAA and it's a privacy thing and it's a personal thing. I totally get that. So then we need to figure out a way or encourage a way or something, because what we're going to continue to see is more people getting sick because folks are walking around. And I had someone tell me last week at the mobile clinic, I'm not vaxxed, I'm not getting it, but I walked into the stores without my mask because they're not requiring masks anymore. So we can say the honor system all we want to. This is the whole reason why we have laws on the books, and people break laws every day, whether it's speeding or jaywalking or whatever. So I'm very concerned, and I get the data, I get all of that, but I'm still very concerned knowing that we're going to just essentially, while it's hot, when everyone is gathering, release the public and then say, you know, have the honor system. I think, and I get it, this health order is tied to, you the previous data information and the issues. So I think now we need to figure out a creative way to ensure that we're keeping the public protected, because this is going to be problematic. And what I don't want to see is our numbers spike again, and then we have to all go back and take a step back, because vaccination hesitancy is definitely a thing. So I don't know what the solution is outside of maybe putting in another order and potentially having a small nominal fine, but then that might not incentivize. So I don't have the solution right now. I'm thinking through it, but I wanted to get from you all, what conversations about this have you had, or are you just sticking with the honor system?
Thank you,
And
Alderman.
for the mayor and the mayor's office and for the health commission.
Okay, I will answer quickly. A couple of points I want to make. One is, and I just figured this out, so I just want to mention, is the census tract with the least vaccinated population is census tract 96 and 53208 is 20.7%. I do think what's working in our favor right now, which is also why I was comfortable with expiring the health order, which I feel is being lost a little bit in this conversation, is we in Wisconsin and in Milwaukee enjoy being outside in the summer, and the weather is finally allowing us to be in that space. The virus recent data it's transmissible outdoors in 0.1%. It is very rarely gets transmitted outdoors. So I think that is working to our advantage. It certainly played into the decisions that were made around the health order. So again, that buys us some time over the course of the summer. The other piece around vaccine hesitancy, and I know Alderwoman Lewis, you experienced this in your church last weekend, but the Kaiser Family Foundation has great data out there. So I know that the idea has been raised to do a survey. I'm not sure that spending time for us doing our own survey in Milwaukee when there's already great national data to vaccine hesitancy would help us or give us any more information that we don't already have. But we know that 40% of people under the age of 30, black, brown, white, under the age of 30 are not interested in the vaccine, nor are they concerned with COVID or COVID infection. And I think that's important because we are seeing that there's an entire percent of an adult population, granted our youngest population, that's not interested in being vaccinated. So again, we are trying to focus efforts. When we see these numbers of 20.7% in a census tract, it's highly likely that the people who are older in that census tract, given our overarching that over 80% of vulnerable individuals in Milwaukee are vaccinated, that those are younger people who just aren't interested and they don't care if they get infected. So we are trying to counteract that with all of our resources, trying to incentivize, thinking about going to the Bucks outdoors event, thinking about Juneteenth. There are other incentivized events that are occurring in the next couple of weeks that will be announced by the end of the week that we are hopeful will very deliberately target those populations. And then Aaron, I'll turn it over to you.
Sure. Alderwoman Lewis, first, thank you so much for picking up and hosting that clinic at your church. I think that's a great example of how we're going to have success. And I know the mayor and our office have made sure that our business improvement districts and our neighborhood improvement districts have all gotten connected with the health department to do both employee and event clinics over the course of the summer. I think we're expanding into employer clinics more and more, hopefully to be able to get people where they work. And I think one of the things after the CDC guidance came out, which took almost everybody, including anecdotally, I've heard the White House was a little taken by surprise by the release of that guidance and what it said. The guidance was based in science. It presented some challenges locally, and one of the questions we had is, well, how do we enforce this? And the city attorney felt very strongly that an ordinance needs to be specific to be enforced, and so we would have to have the burden of proving that somebody was unvaccinated, which is really difficult to do. And I think balancing our ability to do that with our ability to talk about both vaccination and to continue, as the commissioner said, reminding schools of best practices and encouraging, following the CDC guidance, on kids masking, which is still the case. Private businesses can still make masking decisions. Employers can make masking decisions. Individuals can make masking and risk decisions if they are vaccinated, and we hope unvaccinated are making smart risk decisions as well. And I think that was one of the things we wrestled with. The other thing is that just as the disease burden has reflected inequities in the city, vaccinations are reflecting those inequities, but enforcement of a mask mandate would also reinforce those inequities, because those communities, if you're enforcing a mask mandate, would be disproportionately enforced for certain. And I think that's something that we always want to be sensitive to. We want to help people with good public health information. I think the voices that, Madam Chair, you and your colleagues have, sharing your own vaccination stories, doing, I think, similar to what Alderwoman Lewis did, helping set up those clinics in your communities, as trusted messengers, you have a lot of power there. And I think that's a really successful path, and the path that we want to go to that's going to get us out of this. And if the course changes, the commissioner can reinstate those orders. She's got that power under state statute whenever she deems it appropriate. And we certainly hope that it doesn't come to that, and we're going to continue to pull together and promote vaccinations over the summer.
So I appreciate the commentary, because I'm not saying that I have the answer. I'm just saying, are we talking about the solutions? Because I don't want to have, it's a double-edged sword, right? Because the most vulnerable are the minority communities right now, because they're the highest population that isn't vaxxed. But I do know that, the folks under 30 are absolutely, they feel they're resilient. So even the ones that have gotten COVID and was very sick, they were still saying, well, I don't really need the vaccination. So I'm not saying I know the answer. I'm just saying we need to figure out something, because I'm concerned that we're going to see some increases. And then to talk about, the small percentage of outdoor transmittal is interesting, because my son was one of the ones that he was just outside and he got COVID. So I was happy to be able to get him vaccinated, but he was one of the ones that was outside and just doing nothing, just around our house, and got COVID. So it was interesting to me to see that someone that young could get it outside. So I don't know what the answer is. I feel like we need to just continue the conversation. So thank you for allowing the time.
Yes, thank you, Alderwoman Lewis. Thank you for sharing that. Other committee members, I want to go to someone who hasn't spoken yet, Alderman Russell Stamper. Good morning.
Hey, good morning, Chairwoman. Thank you very much. Hey, I apologize if I missed this question and answer. Did the commissioner address the percentage of why the rationale of the removal of the mask mandate? Did you say it was based on percentage, or what data she used?
Thank you, Alderman Stamper. Commissioner Johnson, the question is, what was the data that you used to rescind the health order and therefore the mask order?
Well, I guess first, is that true? You're using the data? Are you basing this off data?
Yes, we are using the data that we've been tracking since the beginning of the pandemic to make these decisions.
Okay. So do you have the data on people, the deaths and spread of COVID? Are people not getting COVID anymore?
So the burden has decreased exponentially in the last month, which is one of the decisions. We verified that data with the sewage data, so we make sure that it's not just the fact that people maybe aren't being tested. Our hospital, the reason we put the order in place is really to prevent severe outcomes and preserve hospital capacity, and to prevent deaths. And deaths have decreased significantly. Hospitalizations are the lowest they've been since the beginning of the pandemic. So we're in a place where the disease is going to be endemic. we are going to have to live with COVID indefinitely, that this disease is going to be present in our communities moving forward, much like flu is. And I think we're just moving to a new phase. And another part that played into this decision is we're moving into summer. And if you look at the data and compare what occurred last summer to now, we know that cases also decreased over the course of the summer, primarily because people are outdoors, and they decreased even without a vaccine. So we anticipate that this exponential decrease will continue.
Sure. Thank you. What is the actual decrease, though? Is it 50% to 20%? What's the actual decrease in deaths, hospitalizations, and cases?
So I can give you the actual percentages. I don't have them right in front of me. But the burden, for example, we were at 118 cases per 100,000 4 weeks ago, and today we're at 52 cases per 100,000.
Okay. So in reverse, if this mask mandate has an adverse effect, what percentage, or how would you judge the return of the mask mandate?
So the mask ordinance is independent of the health order. I would put another health order in place if we saw a sustained increase in the number of cases. So not a blip, but a sustained increase in cases, and that would, and if we saw an increase in hospitalizations, but I wouldn't react with just one little blip here or there, which is what we sort of saw occur in April. We had a decline in March, but I would want to see a sustained increase in the total number of cases, in which case I would put a health order back in place.
Okay. And the mobile clinics, how many of them are there?
So we have scheduled, I think, 265. And of those, 127 have been done. I believe that we've administered almost 28,000 doses at those clinics, and we have them scheduled out through the course of the summer, with more being added all the time.
Sure. You tell us the schedule and I guess the information on where they are and when they're coming.
Sure. So we have that information. We really look at, as the requests come in, we look at the location, the number of people who would be vaccinated in that place. The team that's scheduling it is Dr. Tomorrow and Deputy Commissioner Marlena Jackson have been instrumental in some of that work and have done a tremendous job of pulling it together. We also recently have teams who've been mobilized with backpacks so they can attend large events like Juneteenth or the Bucks playoffs in that central plaza where the big cameras are being played. And I believe that the spreadsheet with all of the mobile clinics was sent, the list was sent to all of you last Friday.
Okay. And how many actual mobile clinics are there? Is it one?
We scheduled 265.
No, I'm talking about it's a vehicle, right?
No, it's different. We set up in different locations. We do have a vehicle, but we have set up in different locations. The teams vary in size dependent on the event. For example, yesterday we were at a church and I think we had 3 vaccinators. So again, the teams really are, it depends on the size of the population and where they go.
Okay, you keep mentioning Juneteenth. Will they be there?
Yes, there'll be multiple vaccinators at Juneteenth.
Okay. All right, thank you very much.
Thank you. Next up, who requested to speak is Alderwoman Jocasta Samarripa.
Thank you, Madam Chair. Thank you, Commissioner Johnson, for being here with us this morning. I wanted to ask you to speak a little bit more specifically to numbers on the near south side. I know right after I was elected last spring, unfortunately, we saw really terrible hot spots in my district in 53215. And I know it's already been mentioned, Washington Park 53208 is only at 20%. Can you speak to 53215 on Milwaukee's near south side and 53204?
Sure. So actually, I know that 53215 had pretty adverse impacts from the virus itself, a large burden in terms of number of diseases and deaths. But I can tell you that the percent of residents primarily in 53215 who've received at least their first dose is almost 50%. It's 49.9.
49.9 for 53215?
Yep.
Okay. Anything on the near south side that is as low as the one that was mentioned at Washington Park?
No, it's really interesting. So the south side is really the 40%-ish is probably the lowest. of any census tract, but it's much higher than in more north in the city.
Okay, thank you, Commissioner.
You're welcome. Thank you.
Great, excellent conversation here. Any other questions or comments from committee members or aldermen before we move on to the public testimony? Alderwoman Milele Katz.
For the commissioner, when was it determined that the health department will be doing vaccinations at Juneteenth?
When will it be determined that we're doing? We are planning to do them. We will be there.
No, I'm saying, when was it determined? What day?
Oh, that's a good question. I don't know. I can reach out to the doctor tomorrow and tell you. And there's more. Going to be more than one.
Yeah, I'd like to know.
Yeah, there's going to be multiple location.
Okay, yeah, I would like to know that date. Additionally, Madam Chair, you asked a question earlier about the rule for the city. I have the same question of Commissioner Fasahaya. She did send me in writing, and I'll forward it to you, Madam Chair. But her response was, we have determined that the requirement to wear a mask for employees and members of the public in city facilities will remain regardless of vaccination status. Employees are permitted to remove their mask when in their cubicles or office alone, but that is the only exception. This requirement will be reviewed on a regular basis. That's what she forwarded to me when I asked that same question. Aaron, you said that you all are dealing with the hesitancy issue. How exactly are you dealing with the hesitancy?
Well, one, we're looking to experts and looking to both public health, the Medical College of Wisconsin, Milwaukee County, and a number of organizations have pulled together. To pull together vaccine campaigns targeting, as the commissioner said, some of those demographics that are really what they call the movable middle, where they're not quite sure, they're taking a wait and see, going to trusted messengers to set up clinics, but also to sit down with pastors and clergy as leaders and get them the facts on vaccination. And I think that's been one successful path. As I said before, we're working with business improvement districts and employers. The commissioner is working with schools. I think there are 3 or 5 MPS schools that have been set up as vaccine sites specifically for 12 to 15-year-olds. And of course, as parents come in, we want to make that opportunity available for them. I think some of that, the success that we've seen in 53215 and 53204 in terms of vaccination rates has a lot to do with those trusted messengers. The mayor is very glad to be able to work with the Mexican consulate as well, so that they are a vaccination site, knowing that there's no wrong place to do it. I think those messages, sustaining them and finding people where they are, and I know, Alderwoman, you're very familiar with this, that people don't necessarily get their news and their info from the TV news or from the paper. Social media is a big component of that, and we're going to continue to focus on all of those channels.
Yeah, I've seen some of the trusted messenger campaigns. It's just that the reality of, having some areas that are predominantly African American in particular, with, 20 or so % vaccination at this time, is to me an indicator that whatever we're doing is not enough. So it makes me think of this. Are we examining other cities who may have similar populations to us who have higher numbers of vaccination and some of the things that they're doing to penetrate those communities that may have historical hesitancy with things like vaccinations? Like, are there some examples where they're having a greater level of success than we are for penetrating those communities?
Alderwoman, that's a great question. I'll throw it to the commissioner. I'm sure public health is very focused on this, but I think anything we can do, and I would certainly, again, invite all of you to lend your voices to anything we can do to help increase vaccines across the city.
Alderwoman Cox, we have been looking at success stories in other cities, and to be honest, Milwaukee has been identified as a success story with our ability to do our mobile vaccination sites. So we've actually been a leader in the country. That said, I recognize that our vaccine rates in many census tracts is low. I think part of this truly is it's just time and people being more comfortable and hearing from friends and family and people they trust that it's safe. I certainly would like to see our numbers increase faster, but I really do believe that the message has to be appropriate and culturally appropriate. It has to come from someone that people trust, their pastor, an older person, someone, a friend, a cousin, whomever, a family member. And it takes time. I think it really takes time. And we know we're also fighting against a lot of misinformation. That said, we have our Crush COVID crew that will be starting in June. There are many other efforts. I want to say over 25 organizations in the city of Milwaukee were funded to do work in neighborhoods, to work closely with neighborhood organizations, to get information and accurate information out. I think that's just been one of the challenges. We are working against social media and misinformation and trying our best to counteract it. And I think part of this is it's really just going to take time.
Erin, you were talking about the lifting of the mask mandate, but how businesses, people doing events and things of that nature could still have the ability to require masks if they so chose to. Under the mask mandate, it's clear, where the enforcement lies and what the repercussions would be. With lifting of the mask mandate and the individual ability of businesses or people to require masks for their events or business, where then does the enforcement ability lie? Or is there any?
I would want to talk with the city attorney about that, because I think without a public health order in place for the mask mandate, again, we're getting to a place where, as the commissioner said, the disease is endemic, and they will continue to contact trace and stay on top of cases just as with any other communicable disease. But we'll monitor that and see where things are. I think our community spread numbers, based on what the commissioner said and public health expertise, is what's going to guide us in terms of turning orders back up and creating that enforcement tool again. And the commissioner may be able to speak better to what they're looking at in terms of enforcement and norm setting.
Enforcement of the mask order, and again, this comes back to, the mask ordinance is really incredibly challenging. I think that is how we got here. I think the CDC, when they put out their science-based guidance, which is absolutely accurate, that individuals who are vaccinated are not at risk of spreading or contracting disease indoors unmasked. It just makes it very difficult for us to enforce. There's no way to know who's vaccinated and who's not. And masking is not a substitute for vaccination. And I think that, again, our effort and our energy and our messaging has really been heavily focused on getting vaccine in arms.
I would like a legal answer to my question. It's one thing to tell businesses or folks that they can have events or within their business require a mask, or even here at City Hall. Since that's the plan of DER, what if an employee says, I don't want to wear a mask? Is there any enforceability? Can we enforce it? And who has the legal right to do that? That's a legitimate question that I would expect an answer to before June 1st. And that's something that I would think even with the thought of rescinding the order, that would be thought given to that prior to the rescission of it. So yeah, so that's important to me to get an answer to that. I also just want to state for the record that I would agree with Chairwoman Dimitrievich that these are hard times. I think none of us professionally have had to face something like this and having to deal with the ebb and flow of everything that's been happening over this last year. But I think it is made a little bit easier to deal with if lines of communication are open between those who help to protect the public and to help to set these rules for the public. It is unfortunate that we had to have this meeting today for members and the public to get a little more clarity on what's going on. It would help if we were informed earlier about the direction that things may be taking so that we can weigh in on things a little earlier and so that maybe we can be a little more unified in how we come out to the public about what's going on. I also would just say before we hear the public, I have deep concerns about the impact of the lifting will have on the African American community given the low vaccination rates in the community. And let's not pretend that the vaccine alone is going to keep people from getting COVID either, because we know from all the data that there are people who get vaccinated who still catch it. So it's our best chance, I get all of that, but the reality that Black and brown communities already have been most impacted by COVID, and the fact that Black and brown or Black community is some of the most unvaccinated, which is our best tool to fight it, and now we're going to take away the extra things that aid the requirements that aid in people potentially not contracting it to me just opens up the floodgates, particularly for the Black community here in Milwaukee. And so my last question that I have at this time is for you, the health commissioner. In answer to Alderman Stamper's question about, what would trigger going back to once these are lifted, what would trigger going back? And you gave a general answer about the numbers increasing or cases increasing. I get that overall, but what if the cases increase for African American? What if the cases increase for these groups, even if the overall numbers are wherever they are? But what if a segment of our community continues to rise? Is that enough trigger? Or will it take an overall rise for you to feel like there needs to be an order?
Alderman Cox, I think that's a great question. Like any disease, communicable disease, if there's an outbreak in a specific population, we really focus our efforts on stopping and slowing the outbreak, and would do whatever it takes to make that happen. And I can speak, we do that frequently when there's an outbreak in a long-term care facility or, STIs, for example. We do a lot of work around sort of stopping the spread of the disease, whether in all populations, but certainly when there's an outbreak. Again, I think COVID is going to be endemic, and we're going to live with it in our communities, and similar, we would treat it as we would any other communicable disease moving forward. I do want to speak to the enforcement of the current mask ordinance, the way it's written. So there is no way to enforce the current mask ordinance against an unmasked individual, and no way to ask them whether or not they're vaccinated or unvaccinated. The current ordinance is written specifically to businesses. So if a business was not enforcing the mask ordinance, we could fine or write a citation to a business. So it's not for individuals. There is no enforcement capacity for individuals.
So I still would like to know the answer, though, to the question about a business's ability to enforce it once this is lifted. Because if I'm going to make a rule as a business, and not just business, but events and all that kind of thing, if I'm going to make a rule as an event planner or as a business to say no mask, is that just me saying no mask, or can can I actually enforce it? Do I have a legal right to prohibit somebody from coming into my establishment if they don't have a mask on? Do I have a legal right to kick somebody out from my establishment or my event if they don't have a mask on? And I'll give you a very practical example, and I know it's an outdoor event and all of that, but it's an immediate thing. I was just on a planning meeting for Juneteenth yesterday. They intend, regardless of what the order is, to require a mask. But can they even enforce that if this order goes through? Is that even real? And so that's what I want to know the answer to.
A private business can enforce any policy they want and remove someone from their premises, is my understanding. But again, I think we need the city attorney to weigh in. But our ordinance, our ordinance only allowed enforcement against businesses.
I get you. The lifting of the ordinance changes the dynamics. And I just want to make sure that if we're going to say businesses can do this or event people can do this, where's the teeth behind it? That's all.
And Alderman, if I can just jump on the commissioner's last point, I think in constructing our health orders with the city attorney, back almost a year ago, one of the things that's really clear is just what the commissioner said. If a business has a policy, it's the same as no shoes, no shirt, no service. They can say no mask, no service. And in fact, I think a lot of businesses really look to both the state and the city in the initial parts of the pandemic to give them an order so that they wouldn't have to have those customer discussions. And it's going to be an evolving thing, both with private employers and private businesses, as to how they're going to incorporate a good health practice into how they do business and how they have employees. Just the same as Director Besahaya and the commissioner are working on our own city employee policies and practices. So.
Thank you. I still want a legal opinion though.
Yes, we'll make, I'll work with Alderwoman Coggs to make that official request to the city attorney's office. I know they have a procedure that they like us to consider. Alderwoman Coggs, have you concluded? I just want to make sure we got everything.
I'm done. Thank you.
Thank you. I see some more people joining us. Let me go to Alderman Jose Perez.
Thank you, Madam Chair. There's been a lot of talk about the vaccination for our youth between the ages of 12 and 15. And we talk a lot about having to fight, stories in social media. And it's interesting because not everyone considers the traditional news sources as accurate or getting the story right to begin with. And we know that they're even chasing stories on social media to cover. So, and I say all that because as a father of a 12 and a 15-year-old, and we talk about vaccinating our young people, and then most recently, the 33 youth in Connecticut, there was some trend around some heart condition, and what do we tell parents that hear that and don't want to get the vaccine for their young people?
Either Commissioner Johnson or Mr. Shapinsky, who would like to speak to that?
Commissioner, I think she's.
I need to step away for 2 minutes. I really apologize, but I'll be right back to answer that question.
Okay. Sounds like she has an answer. Well, in the meantime, while she's going to answer that question, we'll just put a little pause in it. I have an additional question that it's not necessarily related, but I've been wanting to ask just to use this time. In fall of last year, 11 migrant workers died due to COVID at the Seneca food plant, and I send peace to their families. Why I bring that up is we have many large employers around the city of Milwaukee, like a Patrick Cudahy, where we know there was a lot of outbreaks, not in that specific place, but I mean these large employers, meat packing plants, and I feel that it was never truly, even now we're just getting some coverage in the media about last fall. The working conditions at some of these large factories and whatnot make it really hard on folks. and a good amount of workers come from the Milwaukee area. What relationship or plan do we have with those types of large employers? I'm using a Seneca, Cudahy. Patrick Cudahy is one because it's right on the outskirts, so we know people work there, to have vaccinations available for those types of employers. Well, really, their employees. Is any of that discussion going on?
Hi, Madam Chair. This is Marlena Jackson.
Oh, hi, Marlena.
Hi. I can just fill in for just a couple minutes while the commissioner is gone. If I may, can I answer Alderman Perez's question regarding?
I was burning time a little bit with my thing, but let's go back to Alderman Perez that was talking about the, you heard the question about the heart condition being examined? Okay, yes, go ahead.
Correct, and then also I'm happy to address your question too. So for Alderman Perez, the reality is that yes, there absolutely have been documented reactions to vaccines, as there have with all vaccines through all trials that have happened. And so as a health department and really as fundamental health providers in the space of immunizations, we are encouraging all individuals who have concerns. They should always talk to their doctors, number one. And then secondly, as part of the consenting process with the health department and any other space where you're going to get a vaccine, there's a conversation that happens around what you need to be looking for and expecting as far as complications after you receive your vaccine that would prompt you or prompt a parent to have their child go either to the doctor, the urgent care, or the emergency room. So we do our best to provide that information to individuals of any age that are getting vaccines. But at the end of the day, it really is encouraging, if you are concerned as an individual about your child or yourself getting the vaccine, that you talk to your provider to get that guidance. And then to your question, Madam Chair, and Aaron can speak to this because we've been working together on it. We are reaching out to all of our bids as it relates to businesses to make sure that we have built additional relationships with different businesses and different bids around being able to support vaccine efforts in a larger scale. But with that being said, at the beginning of the pandemic, we did have larger scale businesses like Cargill, like Palermo's, that had outbreaks, and it is absolutely, to your point, because of conditions that they work in that are not easily avoidable or easily manipulated. And so we've been partnering with them throughout the pandemic into this vaccine space to provide those vaccines in those particular businesses. So we've been to Palermo's, again, we've been to Cargill and to the Mexican consulate, spaces that are very geographically located closely. And then in addition to that, I think it's just important to know that as we, again, move into the summer, we'll continue this work and continue to make sure that our businesses are part of the vaccine effort, but then also knowing that as we understand and acknowledge that the pandemic is going to be long-term, the health department will continue to maintain our hotline. We will continue to maintain staff that are literally there and here to support businesses, schools, and different sectors as we move through the pandemic. So it's important that people understand that we're not going away, that just because the order is going away, the support that we have provided to the city is still there.
Madam Chair, if I could just tack on to that briefly, with your permission. I've been regularly blown away, and the mayor has as well, by how creative, innovative, and flexible the commissioner, Deputy Commissioner Jackson, Dr. Tamar, the whole health department team have been. And he remains supportive of all the work that they're doing to try to get vaccine to where people are. I think your point about employees who work outside of the city but may reside in the city is a really good one. And one of the things that I've learned over the last year is how great and committed the public health profession is to access and equity. And I think if there's an opportunity to reach out to local public health officers in communities of employment, that's another great path potentially to expand vaccine access and create that door for people. Just the same as we're doing, as Deputy Commissioner Jackson said, with our business improvement districts, with Palermo, and I know a remarkable story from Palermo. There were 7 different languages being spoken and translated at that site, and hats off to Palermo. They created a friends and family event for their employees so that their employees and their loved ones and close ones were able to get vaccinated at the same time at work. And I think that's a great collaboration and the kind of thing that we want to multiply over and over and over again. And so any of those opportunities, the mayor is certainly supportive, and absolutely anything alders have that they can bring in for the health department to deliver that is a great thing. Thank you.
Thank you. Any other questions or comments from committee members or alder persons present? Otherwise, I'm going to begin with the public testimony. We only have a few that are registered here. Okay, I want to thank the public for being patient with us. We had a lot of ground to cover. First is Mr. Steve Hawthorne. Steve, if you want to unmute yourself, please go ahead. You have a couple minutes. Go right ahead, Steve.
All right, thank you so much, Madam Chair and committee members, for giving me this opportunity. I also wanted to thank Commissioner Johnson for all the health department's work during this last 14 months. It's been a really difficult year, and the health department's been a great resource to me personally, so thank you for that. I want to speak briefly from 3 perspectives. First, for my own, I'm a resident of the 13th District. Second, I'm a restaurant owner in the 13th District. And finally, I'm a parent of 3 children who are under 12 years old. Personally, my wife and I are both vaccinated, as are our employees. Obviously, our children are not, as they're not eligible yet, but we do plan to have them vaccinated as soon as we are able. From the beginning of the pandemic, I have committed to following the science. I required masks in my business before it was mandated by the city or the state. I firmly supported the city's efforts to pass a public health order and mask mandate. I was the first business in the city to file and receive an approved COVID safety plan. And I've invested a significant amount of time and money into researching and implementing best practices to keep myself, my family, and my employees and customers safe. Not doing this to brag, but just to say, like, I'm fairly well educated on the topic, and I did it all by following the science. So now that science has determined that fully vaccinated people no longer need to wear a mask in public, I believe it is time to allow the public health order to expire, and the city should now focus efforts instead on increasing the vaccination rate. I definitely share the concern for unvaccinated children and the risk to them. However, I am confident in my ability as a parent to keep my children safe by employing the skills that we've learned over the last year: masking in public, social distancing, and trying to keep the majority of our activities outdoors. For my business this evening, my employees and I are going to meet to determine how we're going to handle our operations based on the change after June 1st. We will use what we've learned from science to make the best decision for us. So while I may not be a public health expert, my research and trust in the scientific community has led me to believe that mandating vaccinated folks to continue to wear masks contradicts the science, and I believe would be the wrong thing to do. Thank you for your time.
Thank you so much, Steve. Really appreciate that. That's a powerful perspective. I just want to clarify, I know you know this, Steve, and anyone listening, you know, today we're discussing the rescinding of the order, but we are not debating it, in that it is truly an administrative decision. The commissioner holds that power solely, and the mayor provides a great deal of advice that does not exist in the Common Council. So we're certainly discussing it as we should, but we're not debating, nor can we decide at this level if it should happen. But thank you so much for your perspective, and thank you for all the small business owners that have survived this far. It's been challenging. Thank you. Next up, we have Mr. Dave Weingrad. Dave, go ahead and unmute yourself, and you definitely have a couple minutes. Go ahead, Dave.
Yeah, thank you very much, Madam Chair and the committee. So this has been a very interesting discussion to hear. I guess, you know, I'm just, my sense is it's a mistake to lift the mask mandate. And there's a couple significant reasons. The significant is really, I think we should be as cautious as possible. We know that the virus has passed most indoors. We have no way to determine whether someone has been vaccinated, not vaccinated when you are indoors. I have a 9-year-old grandson who now I'm not sure should I be taking him inside or not in any inside venue. And I appreciate what the restaurant owner had to say, and I'm sure it's been tough on their business. Perhaps there'd be nuance on how to enforce mandates, but I do think it's important that to look at areas of the city that have much lower rates of vaccination. And obviously it means trying to do more to get them vaccinated. But in the meantime, we're all going to potentially be affected by that. And so my sense is keep the mandate in place, keep the indoor masks being worn. We're kind of used to it. It's not a big burden on anybody to wear a mask. And it just, for me, it just makes us, when we're indoors, more feel more vulnerable, I guess, is the way I'd say it. Anyways, thank you very much for your time.
Thank you, Mr. Weingarten. Next up, Mr. Paul Mozina. Please unmute yourself and you have a few minutes.
Thank you, Chairwoman Dimitrievich and committee members. I'm appalled. I'm appalled at the way this discussion is evolving, and you all are pretending that the vaccines are an unalloyed good, that everyone should get vaccinated, and you say you're following the science, but the science is unequivocally pointing to the fact that the origin of this virus is from a lab. Former CDC Director Redfield said that the most likely etiology for the virus was a lab. We know that there were modifications to the spike protein that have all the signatures, all the hallmarks of a lab-manipulated substance. And then so we have the vaccine manufacturers have taken this genetically modified spike protein and they've encapsulated it in a lipid protein. They've altered it to avoid the human being's natural immune system, so that it can produce the antigen that it's designed to produce. So we have compounded a modified, genetically modified spike protein, further modified by the vaccine makers, and we're in the midst right now, which y'all don't seem to want to admit, we are in the midst of a vast human trial. None of these vaccines are approved. They are emergency use authorized. These trials are not complete. We have no idea about the long-term or short-term effects of this vaccine, these injections, because the data is still yet to be determined. For anyone to say that we are going to limit your freedoms contingent on you participating in this reckless, dangerous human experiment, it's appalling, and you have no right to do this, and it's a violation of the Nuremberg Code because you're not informing the public. You're not providing informed consent. I haven't heard any mention of all the injuries reported on the BAR system, the Vaccine Adverse Event Reporting System that the CDC started in 1990. And somebody said, oh, forget the BAR system. That's just, those aren't proven. There's no causation proven by a BARS report. Nevertheless, the numbers of adverse events reported for COVID recipients of the COVID vaccine is astronomical. There's over 4,000 deaths reported, over 220,000 adverse events, over 18,000 severe adverse events, and the CDC is failing to investigate these adverse events. And maybe they don't have the resources. They're simply falling down on the job. And we have Harvard studies, we have various studies by entities that have shown that the reports of adverse events to the bar system are significantly underreported. Possibly 1 to 10% only are reported to bars. So we have a vast amount of evidence that there are significant side effects for these vaccines, and you all are pretending that it's an unalloyed good, and that anyone who's hesitant to take these vaccines is simply just subject to social media propaganda. I'm sorry. There are legitimate concerns about these vaccines that you're not paying attention to, and again, the pressure on the population to accept participation in an experiment. This is an experiment.
You have 1 minute left. 1 minute.
I appreciate you. Thank you for reminding me. This is an experiment. I don't know how else I can. They have no. Look, you want to give this vaccine to pregnant women, to people who have immunosuppressed systems, to people that have already been exposed to the virus and have gained a natural immunity. You're pretending that there's no value for natural immunity whatsoever. And the science, you keep quoting the science, but the science is not clear on how long the natural immunity persists, or how long the so-called immunity given by the vaccine will persist. This is a vast experiment. Nobody knows what's going on here. We have no idea how this is going to, if this is going to affect future generations. And the CDC and everyone is ignoring the huge and accumulating number of adverse events that are being reported for these vaccines. And I just think it's an abomination that there's any pressure. Okay, I thank you for letting me speak. I really do appreciate it.
Of course, we definitely are open for everyone to speak. Thank you, sir. We also had Ashley Thompson. I don't see Ms. Thompson on the board. Just want to make sure I'm giving everybody an opportunity. Okay. There was over 30 e-comments submitted. Hopefully I asked that everyone take a good look at them. They were really interesting and asked a lot of great questions and provided great points. And then our last call, any other public that's joined us that wishes to speak? And lastly, any other committee members or council members have any final questions or thoughts at this time? Concluding information from the health department before we wrap up this matter?
No, thank you for the opportunity to have this conversation.
Okay, thank you. With this, the Public Safety and Health Committee will be moving to quarterly reports of the famous item number 1, letting all the staff know, which is always the communication file on our response to the pandemic.